Thank you for joining us today. We are super excited. We will be getting started very shortly. We just want to give everybody a few more minutes to come on, and we'll be back in a moment. Good afternoon, everyone. My name is Ashley Rosick, and I am a physical therapist and the clinical director of our Midtown West location at Spear Physical and Occupational Therapy. I'd like to welcome back those of you who have attended one of our other webinars, as well as welcome those of you who are joining for the first time. Thank you all for choosing to spend the next hour or so with us. For those of you who do not know who we are, Spear is a private outpatient practice that has been around for over 20 years. Currently with 20 locations located all over the New York City metro area. We have continued to successfully offer in-person care through the COVID-19 pandemic, and we are strategically going above and beyond the CDC guidelines to ensure the safety and well-being of everyone within our clinic. For detailed information on the safety measures that we're taking, please visit our website at spearcenter.com. We have also launched Spear Live for those of you who are looking to stay in and receive care from the comfort of your home, as well as Spear on Call. This gives you the opportunity to receive physical or occupational therapy treatment through our telehealth platform from any device, or have a therapist come to your home for treatment. We are here for you in whichever way makes you feel the most comfortable. If you're looking for individualized care, please reach out to us at your convenience and we'll get you set up for an appointment right away. We're here with you today because since the COVID-19 pandemic started, people have been working out on their own at home. And now that things are slowly getting back to normal, people are getting back into the sports they love and returning to the gym. Our team of clinicians got together and we agreed that given today's challenging circumstances, it would be a great idea to provide all of you with some tips on how to both prevent and address any symptoms you may be currently experiencing as a result of this new normal. We created today's talk specifically for you, and we're coming, as you can see, live from our own homes or our impeccably clean clinics. We do not anticipate any technical issues today, but please be patient with us as we navigate working through this new technology. As part of our session, we will be demonstrating and going through some exercises, and we really look forward to you following along and participating. I promise this is not going to be like your normal, typical, boring Zoom meetings. This is going to be fun. Please note that if you're experiencing any pain while performing any of these exercises that we do together, please stop and reach out to us directly so that we can support you. Just some housekeeping. Throughout the webinar, we want to hear from you. If you have any questions, please feel free to let us know your thoughts in the Q&A feature. Now I'm going to take you a tour of the computer screen. Going to take a moment to show you where that is. If you hover your mouse down at the bottom, you will see the Q&A option pop up. That is where you will put your questions, and we will do our best to address as many of them as we can during this webinar. It is best to put the questions in the Q&A spot and not the chat. If you put questions in the chat feature, we will likely be unable to get to them during this webinar. For those of you who are watching through YouTube Live, we are monitoring the comment section there as well. So please feel free to type in your questions and comments. Lastly, there will be times where multiple panelists are on the screen. So while we are on the tour of the computer, please bring your mouse to the top right corner and you will see gallery view. That is so that you can see all the panelists on the screen at the same time. So let's talk about our goals for the day and what we will be covering. We will discuss the anatomy and current statistics regarding ACL injury and present key points regarding jumping and landing. We will then present some warm-up and exercise strategies to help prevent ACL and other knee or lower extremity injuries from occurring. And lastly, we'll take some questions from you. Ultimately, we want to get you moving. We'll be demonstrating exercises throughout the webinar that you can do to treat and diminish this pain. Please feel free to practice along as long as you do not have any pain. Before we get started and before we introduce our team of panelists, I do want to give everyone a quick update. Our original presenter, Brittany, had an emergency and she cannot be with us today. But you know what? Like we say at Spear Physical and Occupational Therapy, life can't wait, and neither can this webinar. So I will be stepping in to help teach and demonstrate some of the exercises for all of you. And without further ado, I'd like to introduce the rest of our panelists. We're going to welcome everyone onto the screen right now. First, we have Miss Sarah Lloyd, who is a physical therapist at our West 44th Street location.
Hi, everyone. Thank you for joining.
Next, we have George Stamboulis, who is a physical therapist and the clinical director at our 44th Street office. He will be helping with answering the questions.
Hey, everybody.
And just a reminder to everyone, it is best to be in gallery view so that you can see everyone at the same time. And if you've done that, you can see all three of us on the screen right now. Okay, so George and I are going to say goodbye for now, and Sarah, we'll let you take it away.
Awesome. Thanks for the intro, Ashley. Okay, so this is going to be fun. We're going to talk about ACL today and go through some exercises that will help prevent both ACL and other sorts of knee and lower extremity injuries, like Ashley said. So thank you for joining us. If you're joining late, the one thing to remember is just to put your questions in the Q&A feature instead of the chat feature if you can, because that will help us out a lot and we'll actually be able to answer your questions. So the first thing I wanted to go over with you guys before we even touch on anatomy, let's see how prevalent this is. So we're going to get a poll going here. And how many of you have actually had an ACL injury? It's actually, I think, very common. We've all heard about it. We've all talked about it, especially if you participate in sports. It's super common, right? So let's get an idea from you guys of how common it really is. Especially, I know a lot of people have kind of like had an old ACL injury. Maybe they had surgery, maybe they didn't. Some of these exercises that we'll run through today will help with any and all of those sorts of pain. Okay, so it looks like about 40% of you have not had an ACL injury, about 30% have, and then another 30% are not quite sure. So this is great. We'll go over the anatomy of the ACL, which will help us kind of figure out where we are and what it is. And then we'll talk about injuries, and then we're going to get into some both preventative and strengthening exercises to help you prevent and recover from an ACL injury. So now that we're going to get into this PowerPoint. So what is the ACL? The ACL is a ligament in your knee. So it goes from your femur, the top bone, down to your tibia on the bottom. And its main job is to restrain your tibia from sliding forward on your femur. So what that really means in real life is a lot of people tear the ACL one of two ways, either a non-contact injury or a contact injury. So a non-contact injury could just be you plant to go turn, and maybe your foot stays planted and your knee kind of goes the other direction. That's a really common way to tear your ACL. And why that happens is as your knee collapses inwards, you put stress and strain on the ACL. And if your muscles aren't strong enough or they're not active in certain ways that we're going to go over later, you can add to that stress and strain of the ACL. And if it's not strong enough, it can tear. So that's how a lot of people tear their ACLs. You'll see those professional basketball players that come down from a rebound on one leg, their knee dives in, and there goes their ACL. So that's really common. The other way is a contact injury. So a lot of times in football, for example, maybe a lineman falls to the ground and someone falls on top of him on the outside of his knee, pushing it inwards. That's another way that people commonly tear their ACL. So some of these ACL injuries we can prevent, and some of them we can't. So let's go ahead and go on to the next slide, we're going to talk some statistics. So there are upwards of 300,000 ACL reconstructions performed annually. That means that there are 300,000 surgeries. There's more people than that who tear their ACL who don't get surgery. And then there's a few other surgeries that, that aren't reconstructions that we can dive into later if we have questions about them. That's a lot of people. It's a lot of people from the ages of even as low as 12 all the way up through adults who are just trying to play sports for fun on the weekends and maybe hurt their knee doing it. So especially in that younger category though, with the kids, there's been an increase in ACL injuries lately. Part of it is to the fact that kids are specializing in sports earlier than in previous years. So within the last 20 years, a lot of kids are starting to play one sport much earlier than they have in the past. Like they're knocking out the other sports. Instead of playing soccer in the fall, basketball in the winter, and lacrosse in the spring, they're only playing soccer, right? They're playing their school team, maybe they're playing their club team all year round. So that's one big factor that we're going to address today, is that we want to keep everyone moving as much as possible and moving in as many different directions. The great thing about playing multiple sports is that you get exposed to many different movement patterns, different cutting patterns, and it changes up the muscles that you're using. If you use the same muscles over and over and over again, that just increases your likelihood for them to get fatigued, get tired, and then that is really what puts your ligaments at risk. So one of the other factors that I want to discuss here on this slide is that there's a lot of ACL injuries, right? And I mentioned before, some of them are preventable and some of them are not. So there's some factors that you can't really control, right? Females tend to have more ACL injuries than males. Can't control that. The width of the notch in your knee where the ligament goes in, you can't control that. You're born with it. Same thing with like the bony shape of your hip. So some of these things, some people are just more likely than others to be at risk for tearing their ACL. However, especially in young female athletes, there are what we call biomechanical faults. So things with your jumping and landing and cutting mechanics that we can improve with strength, with physical therapy, with all of these other techniques basically that we can use to address these biomechanical faults and change the way that your muscles are firing to make it more likely that you don't land in those positions where maybe your knee dives in or maybe your knee is unstable because your hamstrings aren't as strong. So these are some preventable risk factors that we can use in PT or in even like athletic training or some personal training that can really help prevent some ACL injuries. But again, there's nothing that we can do to entirely prevent an injury, especially in sports that involve a lot of cutting and changes of direction. That being said, when you do have an ACL injury, it's a tough one. It takes a long time to recover. Nowadays, people are saying that it takes at least 9 to 12 months to return to sport, at minimum. That means that if you are an elite college athlete, you are going to take at least 9 to 12 months to return to sport. We can go ahead and go on to the next slide because this mentions research in regard to returning to sport. So it's really important to hit these markers after you've had an ACL injury before you actually go back to playing. So there are things that we look at, such as your quad strength. Is it 90% at least compared to the other leg? It is when we do hop testing, which we'll go over in a bit later, some of those exercises for hop testing. Is it 95% compared to the other leg? And then the Y balance, which is shown on your screen, is just a series of tests that we use to pretty much test your leg strength and balance. We want that to be symmetrical, side to side. And crazily enough, only 73% of people who have had ACL surgery pass their return to sport tests at their 12-month post-op visit. So think about it. That's a full year later after you've had the surgery, and 73% of people pass that test to clear to go back to sport. So it's a pretty tough injury, and it's one of these things where, maybe you go to PT for the first 3 to 4 months, you start back running, you feel good, and you kind of let it go. A lot of us have done that in the past, and maybe it doesn't go over so well because you missed the other 9 months of your rehab that could have gotten you back to 100%. So as we go on to this last slide here, we just have a couple more statistics to throw at you. So part of the reason that this return to sport criteria is so important is because over 30% of people who have an ACL injury have a second ACL injury within the first 2 years after their surgery. So I know a lot of people have had to go through this. How devastating is it when you finally get back and you're playing and you're ready to go, and then the same thing happens on your opposite knee, right? It happens and it sucks and it's the worst, but this is why we choose those return to sport criteria so carefully, and we want to make sure that you hit those criteria before you return to sports. And 37% of these athletes actually don't return to their prior level of sports participation. Now, part of that is maybe because they were a senior in high school who doesn't go on to play sports in college. That's fair, but there's also a lot of people who just never quite get back to the same level that they feel they were at prior to hurting their knee. It's a really, really important rehab, and it's really important to kind of finish that rehab and get all the way through those 9 to 12 months. And you have to be very dedicated. But in the end, if you can get back to the sport that you love, it's so worth it. So that was kind of like an intro to ACL in particular. We're going to bring Ashley back onto the screen and go over some exercises that will help you prevent as much as we can. Like I said, we can't prevent every injury, but we're going to try to prevent ACL, other knee, and lower extremity injuries by taking you guys through some key exercises. So this first bit, we actually took from the FIFA 11 warm-up series. So if any of you guys that are watching are coaches for middle school, high school, college, or you're athletic trainers, really, this is one of the best warm-ups that you can get your kids to start participating in before playing a sport, especially if you're coaching young female athletes. It's really, really important. I mean, you want them on the field, right? They can't play well if they're not playing at all. So taking them through this warm-up, as much as it seems different than kind of like a regular warm-up that we're used to in the dynamic warm-up field, it can be super helpful in preventing injuries. I know we started it when I was in college, and it actually helped decrease the number of girls that were injured on our team. So from personal experience and based on research, it's really, really helpful. So we're just actually going to take you through, we'll send you the whole warm-up series in part of the handout that we'll send to you guys after the webinar. But Ashley and I are going to go through what's called the strength and plyometric portion of this warm-up series. So kind of crazy that you're doing strength in a warm-up, but it's been shown to work really, really well. So Ashley is going to demo the first exercise for us.
Get excited, everyone.
Get excited. So the first one is called the bench. It's essentially just a plank, and you're holding that nice forearm plank position without letting your low back arch, and without letting your shoulder blades kind of wing out to the back and to the side. So keep that nice straight plank. That's level 1. Level 2 of this exercise is go ahead and alternate those kicks, Ashley. Yep, kick back and forth, alternating. Good, for about 60 seconds. And then level 3 is lift one leg up and hold. Woo, it's tough. It's a burner. Nice, good. And Ashley demonstrated that really well as she's keeping her nice spine position, using her core. Awesome. Great job, Ashley.
Thank you. And Sarah is going to demonstrate the next one. So whenever we're talking about lower extremity, we always want to make sure we're working on the core. As you can tell, I'm out of breath after one exercise. So Sarah is going to do the sideways bench or a sideways plank. So level 1 is with the bottom leg bent, and you're holding that up. So that is for about 20 to 30 seconds. To make that harder, level 2, you're going to straighten both legs all the way down. You're going to go into a full side plank, and you're going to tap your hip down to the floor and back up. So this is just a tap. This gets your core working and your glutes working. And level 3 is you're gonna hold that side plank up and your top leg is gonna lift up and down. So we're getting those abductors working, glutes and core together. That is our sideways bench.
Whew. Okay, these are no joke, guys.
Yeah.
They're pretty tough. So now that we've got the core warmed up, we're gonna move on to the hamstrings. So for those of you who don't know, hamstrings are super important. They're actually help keep that tibia pulled backwards on your femur, just like the ACL. So they're what we call the dynamic restraint to your ACL. So they are what really help keep your ACL from tearing. If you have really strong hamstrings, that can be a huge factor in preventing ACL tears. So level 1, basically this one, instead of level 1, 2, and 3, you're just increasing the number of repetitions you do of this exercise. So Ashley's going to demonstrate. Normally, if you're on a team, you have a partner holding your heels down so they don't pop up like Ashley's are. You're going to lean forward, keeping that nice plank position as far as you can until your arms catch you in a push-up, and then you're going to push yourself back up. So you're going to really feel the back of your thighs burning on this one.
That is a hard one.
It's very hard. It's really hard, but it's great, and it's great for any athlete, for sure.
If my couch was big enough, I could have stuck my feet underneath the couch. So that's another way you can do it at home. Okay, the next thing we're gonna do is a single leg stance. So this is working on balance. It's working on your body knowing where your leg is in space. So first level, you're gonna stand on one leg. You wanna make sure your leg is slightly bent, not totally locked out. And you're going to be holding a ball to kind of give you a little bit of weight. You'll hold this for about 20 to 30 seconds, 3 times each leg. And to make it a little bit harder, you're gonna circle that ball around your body. So you're gonna add a little bit of instability here. Sarah's doing it absolutely perfectly. And what you wanna watch for here is that leg, your knee, not caving in, not turning in. Yeah, you don't wanna do what she just did. You wanna prevent that, and that's all that strength. Level 2, so Sarah's gonna use the wall. If you had a friend or a partner, you could pass it back and forth. You're gonna stand on that one leg and you're gonna pass the ball back and forth. So you can still do this at home, guys. You can still throw the ball up against the wall. You'll do 20 to 30 seconds again, alternating each side. And level 3, if you had a partner, you would stand on one leg and that partner would kind of tap you around. So tap you side to side, front and back, add that instability. And with this, with each level, you're working on that leg. You're making sure your knee is not caving in. You're keeping your leg nice and stable. Sarah, excellent balance, my friend.
Thank you, Ashley. Thank you. I've been working on that one.
I can tell.
Awesome. So after the balance, now we're going to go into, we have 2 more exercises left. So there's what they call the squat series. Level 1 of the squat series is actually just going down into a regular squat. You want to make sure that as Ashley's doing, she's keeping her hips down and back. Good. So she's getting her glutes activated. She's also not letting her knees cave in. Yep, exactly. So you'll hear us say this a lot. Like I talked about earlier, one of the common ways that you can injure your ACL is by letting that knee collapse inward into what we call valgus. So keeping those knees out, sitting back, nice and strong. And then what you're actually going to do as part of this program is when you get to the top of the squat, you're going to go up onto your toes and back down. Perfect. Nice demo, Ashley. So now we're getting the calves involved a little bit as well. Perfect. So this is level 1. Level 2 of the squat series are walking lunges. So some of you may have done this exercise before. Take that big step forward, control on your way down, nice and slow and controlled, and then step back up. Same thing we talked about earlier. Keep that knee nice and steady. Don't let it fall inwards. It'll help strengthen your glutes by keeping it nice and straight. Nice demo, Ashley.
Thank you.
All right. And then level 3, the hardest level, we're going to do single leg squats. So on this one, same principles apply. We want to sit our back and down like we're sitting into a chair. You want to keep that knee nice and straight. Don't let it dive inward. Nice. And do exactly as Ashley's doing. Slow and controlled movement. It's not the quicker the better with these exercises. The slower the better. Nice. Awesome.
There you go.
Good job, Ashley.
Thank you. You're gonna have the ultimate gluten quad
I think you got all the hard exercises.
All right, now we are going to go into some jumping. So we're going to use some of the same things we just talked about with the squat. So the first thing you're going to do is a vertical jump. So you're doing that same position of sitting back into a chair and you're using that momentum to jump up. So the important thing you want to focus on with this, what we've been talking about, you do not want your knees to kiss. You don't want them to cave in. No kissing, keep them away. It's pandemic time, guys, no kissing. All right, so you can see Sarah is watching her knees with the jump off and the landing. You want to land in that absorption. She's sticking her butt back like she's sitting in a chair. But where your knees land is super important. Absorb that jump. Level 2, some lateral jumps. So similar to what you might know as ski jumps. You're going to jump one leg side to side. And this is really important, this one leg landing and taking off. It's the same concept we've been talking about. You want to make sure your knee is not caving in. You're landing with it nice and straight, absorbing. And you can make this a little bit harder by jumping further. And level 3 is a box jump. So this does not mean that you're jumping onto a box. It means you're jumping in the shape of a box. So you're going forward and back, forward and sideways. You're adding a lateral movement in there, which is a whole nother ball game for the knee. And same thing with all of this. You're watching your positioning. You're making sure your knees aren't kissing. They're not turning in. They're nice and stable right over that foot with your butt back. Great jumping, Sarah. I'm out of breath from like the 2 jumps I did, so.
Thanks, Ashley. Those are good. So just to clarify for everyone, these exercises, there's 3 different levels so that you can kind of cater it towards the people on your team. Some people, level 1 is going to be a breeze and it's not going to be difficult for them. So they should probably do level 2 or the level 3. But you're going to have some athletes on your team who can't perform the level 2 or 3 exercises correctly, and they should be staying at the level 1 exercises. So that's why this is great. You can kind of cater it to any age, any skill. It can be used for anybody. And it's really, really helpful in that injury prevention. So now that I'm also out of breath.
Now you can go again.
We're going to move on to some strength exercises. So strength is super, super important in preventing injuries. As physical therapists, Ashley and I can attest to the fact that the stronger you are, the better athlete you're going to be, and the less likely you are to get injured. So these strength exercises that we're going to demonstrate today are really good to do in terms of injury prevention, but they're also really good if maybe you're someone who had a knee injury several months, several years ago, and you're looking to get back to sport, but you're not quite sure where to start, or your knee sometimes bugs you. These are some good exercises for you to do to help get back to that pain-free sport that you love. So if you have pain during any of these exercises, please reach out because some of them are pretty challenging. And we want to be able to help you get back to the things that you love to do. So let's see, we're going to start with a single leg squat. So I'll go ahead and demo. Ashley's going to talk us through it.
Sarah gets to do this one. So you saw this one, a little bit earlier with the FIFA 11. So you're standing on one leg and you are sitting back like you're sitting in a chair on one leg. This is a super challenging one. It's really working your glutes, your quads, your hamstring. You're getting everything involved here. And again, this is all about the form. It's all about where your knee is. You're making sure your knee is not collapsing in. It's nice and steady. You're sticking your butt back just like how Sarah was doing. Yep, don't do that. Do not let that knee go in. You're working on the stability. And remember, if you can't go down to 90 degrees, that's okay. Start with a 30 degree, 45 degree, a smaller squat, and work your way down.
Awesome. Okay, so Ashley is going to take us through what we call a single leg RDL. So RDL stands for Romanian deadlift, which is just a funky way of pretty much saying a straight leg deadlift. And we're going to do this on one leg. So what Ashley's doing an awesome job of is the leg that she's standing on is her knee is not locked straight. It's just slightly bent, but it's staying that slight bend the whole time. And she's hip hinging forward at her hips. So the key is her hips are staying facing the ground. I like to tell people if your hip bones are headlights, they're pointed straight down to the ground. Keep those pointed straight down. Nice. And you'll notice a lot of our exercises are things that are standing on one leg. And it's really important to get that single leg stability, we call it, because whether you're running or whether you're doing any sort of sport, you've got to be able to jump, land, cut, pivot on one leg. So as Ashley continues to show us her amazing single leg RDL, this is one that you guys can do because it works on balance, it works on hamstring strength, it works on glute strength. You can add a weight to it if it's easy, and you can progress it that way.
So now that my hamstrings are burning, Sarah gets to burn her hamstrings next. So what she's gonna do next is a hamstring curl. So she's gonna hop back on her table there. At home, you can be on the floor, yoga mat, bed, whatever it is. Sarah's using a ball. So what she's gonna do, she's gonna do a bridge where she's gonna lift her hips up to the ceiling. She's on there. She's gonna curl that ball in, back out. Yeah, so she is gonna be feeling the burn in her hamstrings here. The key with this is squeezing those glutes and pulling that ball all the way into your butt. If you do not have a ball, that is a-okay. You can use socks on a slippery floor. You can use a towel. You can even use like a magazine, something that will slide. And yeah, she'll show you. You can kind of creep your legs down. You're trying to go as straight as you can without actually just collapsing down to the table. This is the ultimate hamstring burn. And like Sarah said before, super, super important for those ACL injuries, any knee injury, giving kind of the powerhouse of your knee.
Yes, that is definitely a burn. It's a really difficult, but really, really important exercise. So thanks, Ashley. All right, next one. This one's pretty fun. So we call them deceleration lunges. Essentially what you're doing is you're working on that deceleration control. A lot of ACL injuries happen in the deceleration process. So we're trying to slow ourselves down and we just don't have the strength to control the speed at which we're going. So what Ashley's doing is she's letting herself fall forward. And then when she feels like she's about to fall, she's bringing that leg forward and controlling her landing in a nice lunge where she's landing with that control that we talked about earlier with every other exercise. So she's not letting her knee collapse in. She's landing with control. So it's perfect, Ashley. What a demo. But the key is, yeah. So we're making it a little more sport specific. This is a little harder, right? So this is an exercise that you would do right before going back to landing and jumping and cutting and playing sports. We want to work on being able to control that knee through these unsteady situations because that's what a sport would present. Nice job, Ashley.
Thank you. Glad I didn't fall. All right, the next thing we're going to do is a step down. So this is a super important exercise because we do steps all the time, right? We live in New York City, we take subways, we've got stairs in the house, we walk up curbs, whatever it might be. So Sarah is going to use a step here. At home, you can use a book, a couple books, a box, whatever it might be. If you have a little step, or if you just want to go on the curb, you can do this. So similar concept here with everything we've been talking about. You are watching that knee stability. You're making sure your knee is nice and stable. It's not shaking. It's not collapsing in. And what Sarah's doing here right now is a forward step down. Now she's going laterally. She's going sideways. And now she's going backwards. So she's doing that reverse step down. So with this, you want to make sure your hips go down together, right? You're not hitching one hip or the other. You're making sure that knee is staying nice and steady over your foot. And kind of similar concept to a squat, you're sticking your butt back. Nice and slow and controlled is the key to this. Again, what Sarah said before, single leg exercises are super, super important. So you're working just on that specific side. And again, you'd always do both sides when you do these. Nice job. Very stable, Sarah.
Thank you, Ashley. That's one of my favorites. All right. So those are our strength exercises. And again, you guys will get this handout after the webinar. So it'll have a run through of all these exercises with recommended repetitions and sets and that sorts of thing. But typically any of these strength exercises can be done for 3 sets from anywhere from 8 to 15 repetitions. Lastly, we're going to go over some quick plyometrics. So if you guys are athletes that are starting to now get back to sports, now that, you know, life is starting to happen again, you want to be able to do some of these exercises before you actually play sports again. Because if we've been sitting around for the past several months, our muscles, our tendons, our ligaments, they're not quite ready for the load of just all of a sudden sprinting and cutting and changing direction. So how we introduce that load is through what we call plyometrics, which basically is just a really fancy way of saying we're going to load the tendons and the muscles and the ligaments in a way that causes a reflex. So they stretch and then they lengthen. They use that energy from the stretch to propel you forward. So it's things like jumping, hopping, cutting, and all of that stuff. So we're going to take you through a couple of jumps, which means with 2 legs, hops, which are with 1 leg, and then a bound, which is from 1 leg to the next. So from left to right is a bound. So Ashley is going to take us through some jumps. The first type of jump we actually went through earlier in the FIFA 11 is just a vertical jump. So she's going to get into a nice squat position, use her arms to help propel her up. And then she's looking at her knees and how they're landing, not letting them cave in, making sure her toes are pointed relatively straight forward. And she's sitting her butt back and down into the chair. Awesome. And for these plyometrics, you want to be careful. The repetitions can be anywhere from 2 to 4 sets of 4 to 8 repetitions. It's going to be a little bit lower. And the first time you do a plyometric workout, you should not do, 3 sets of 10 of all of these plyos that we're taking you through, because it's going to be a lot of loading. So you want to moderate that load and limit your contacts, or basically the number of times that you're jumping total, to about 40 to 60 jumps per session, depending on how versed you are in plyometrics and how often you participate in them. So that was the vertical jump. Now Ashley's going to demonstrate a broad jump for us, which is same sort of position, but now this time, instead of jumping up, she's going to jump forward. Nice. And so she has to decelerate herself on that landing. Awesome. But she's doing it with 2 legs. And it looks great, Ashley. Same thing with the knee position, no diving in. We never want that. She's controlling her landing perfectly, beautifully. 10 out of 10, 10 out of 10. And you can make it harder by jumping farther. Lastly, we're going to do some 90-degree turns. So most sports, you don't just play in one line of motion, right? Maybe running, but any other sport that involves changes of direction, you're not just running in a straight line. So we're going to jump at 90-degree angles. Ashley's going to jump in the air. She's going to turn 90 degrees, and then she's going to come back the other direction. So this is an awesome way to kind of get your legs and your muscles, your hips, your knees used to changing direction. But the key is, even though she's changing direction, her knees are still not collapsing in. Awesome, Ashley. Ooh, well done.
All right, if you guys are doing this at home with us, your heart is pumping right now, as is mine. But now Sarah gets to get her heart pumping. So she's going to show us a single leg hop. So very similar concept to some of the jump squats we've been doing. 1 leg, hopping forward, always watching your knee. Making sure your knee is not collapsing in, not kissing, nice and stable. Always land in a bent knee position. You never want to land with your leg totally locked. That can cause some injury as well. She's switching sides.
Where are we going?
All right, so now you can see her, she's doing some lateral single leg jumps. She's doing some crossover. She's adding in that lateral movement, which is super important for the knee, super important for the ligaments and ACL to be able to stabilize you in those lateral movements. Like she said, we're not always just moving forward and back. There's always some sideways movements in there too. So you can see same thing, nice and slow and controlled and stable.
Nice. Okay, last thing we have for you guys today. Ashley's going to demonstrate bounding. So that's, again, going from your left foot to your right foot and then back to your left foot. So with these exercises, you want to, again, make sure that you're controlling that knee, you're landing nice and softly, and then you're exploding out of that landing. And then this is actually really important because you can jump farther with a bound than you can with a hop. So it's a little bit harder to control that landing, and it's what's going to really help with that controlling the deceleration, which is, again, one of the common mechanisms of injury for the ACL and any other sort of knee injury. Awesome, Ash.
Woo! All right. Sarah, this was a lot of fun. The awesome presentation.
I'm tired.
I'm tired. I'm like sweating and out of breath right now. So we're going to go over some of the questions that you guys have sent in. Remember, it's in the Q&A box. All right. First question here. How long does it take to fully recover from an ACL injury?
Oh, okay. So that is a good question. We briefly touched on it earlier, but I think a lot of what people used to do in the past, people used to be coming back from an ACL injury at 4 to 6 months, which is kind of crazy now because there's all of this new literature basically saying that if you return to sport anytime before 9 months, you're much, much, much more likely to injure either the same knee or honestly more likely the opposite side. Because I think what happens is we're so excited to get back to sport that opposite knee kind of does way too much. It's not ready to take on 150% of the load. And so a lot of times we end up injuring that other knee coming back too soon. So it really is important to take that full 9 to 12 months of rehab before returning to sport.
Nice, Sarah. Thank you so much. Next question. This is an awesome question. Do you always need surgery after an ACL injury?
That's another great question. So this is actually, I think a lot of people hear ACL, they automatically think surgery, which if you are an elite athlete, and depending on other concomitant injuries, or maybe you have a meniscus tear as well, there are certain circumstances where surgery is definitely required. But you have to speak to your doctor and your therapist about it, because if there are certain situations where maybe you don't actually need surgery, if you're someone who's just trying to get back to everyday activities, just going up and down the stairs without pain, even participating in some light sports every once in a while, like some tennis or racquetball maybe, there are some situations where it's actually not necessary. There are certain criteria that we use to distinguish who needs surgery and who doesn't need surgery. So it's a really important conversation to have with your doctor, and then with your physical therapist as well, if you're already going to physical therapy.
Great. Our next question. I have an old meniscus tear that's healed, but lately I have pain only when walking down the stairs or with squatting. What exercises can help with this?
This is actually a really, really common example. So a lot of people have some sort of old knee injury, whether it's meniscus, whether it's ACL, whether it's even just like some patellar tendinopathy. And then eventually you start to have that pain going downstairs. So it is important to go see a physical therapist and a doctor to kind of get that knee evaluated personally. However, there are some common factors that I can discuss. So basically what happens when you go down the stairs is that you need a lot of really, really strong force from your quads to be able to go down the stairs. If your quads are not strong enough to handle that force of controlling your leg down the stairs, then it can kind of pull at either your patellar tendon, maybe one part of your quad is working harder than the other, and it kind of puts your kneecap in a funny alignment. So there's lots of things that could be going on. I highly suggest going to see someone about it, but strengthening your quads, strengthening your glutes, strengthening your hamstrings is a great place to start, as long as the strength exercises that you're doing are not painful. So some of the exercises we went over today, maybe like a single leg RDL, would be great because it strengthens your glutes and your hamstrings, but it doesn't involve quads yet. And a lot of times strengthening your quads can be painful. So I would reach out to someone like a physical therapist who can give you good quad strengthening exercises that are tailored to you that don't bother your knee. Anything to add, Ashley?
I mean, no, I think what you said is good. All those exercises we did, especially the lateral step down, forward step down, reverse step down, that's literally practicing stairs and practicing the formation and where your knee is supposed to be. So all of those single leg exercises, focusing on that stability should help. Next question. I'm getting some pain in the back of my left knee when I kneel down and when I put shorts or pants on while standing up. I feel fine taking a walk or riding my bike. Is this condition ACL or ACL related?
So that's a good question. And again, one of those questions that I think you should definitely go in person or at least telemedicine with a physical therapist or a physician, because they can reach out to you individually. But generally, pain in the back of your knee can be from a variety of factors. Typically, an ACL injury is going to be from some sort of traumatic incident. So it would have been something where you kind of cut or you planted and twisted, or you really stepped funny or stepped hard. So your knee would swell up because you injured a ligament inside the knee. So if it's truly your ACL or your PCL, you're going to get swelling in the knee. If it's just the type of thing where the back of your knee hurts when you bend, it could be anything from a hamstring tendinopathy to a calf tendinopathy. There's a lot of different structures in the back of the knee. So it's not something that we can just diagnose based on where the pain is, but you can definitely go to a physical therapist for an evaluation.
Very nice. Next question. Good question. For the squat series or squats in general, besides keeping your knees from collapsing in, does it matter where your toes are, if they're pointing forward, out?
So this is another actually great question. So it depends on what you're going for. If you are an athlete who's going to be returning to cutting and pivoting and changing direction, the problem with having your toes out is that if I perform a squat or a single leg squat, for example, and my knee dives in, I can get that same force on the knee with, with my toe pointed out. So if my toe's forward and my knee dives in, all I have to do is point my toe out and have my knee go straight. And now I'm still getting that same core force on my knee. So with squats in general, a lot of people have an alignment at their hips or, tightness in their hips, and it feels better to squat with your toes pointed out, which is fine and dandy if you're just looking to squat and you're looking to strengthen. You obviously don't want them pointed out very far, but if you're doing things like the plyometric exercises or the single leg squats, you don't really want those toes pointed out too far because you're still going to get that same, what we call valgus force on the knee. Yeah.
Thank you, Sarah. Next question is, would it be advisable to have a chair in front of you for some of these exercises if you are senior or if these exercises are new to you?
Definitely. So we went over some pretty high level exercises here today. So if you're a bit older, or if this is the first time you're doing them, especially for these, what we call single leg exercises, you definitely want to be somewhere that you can hold on. So a countertop or a table, a chair that's not going to roll away from you is going to be really good for doing those single leg exercises. But again, if you're having pain or difficulty with any of these, don't do them until you contact a physical therapist or a physician.
Does it make a difference doing these barefoot versus wearing sneakers?
It definitely can. It definitely can. So again, same sort of thing. Like if you go in for an evaluation with a physical therapist, they'll take a look at everything from your spine to your hips, to your knees, to your foot and ankle, because what your foot is doing totally impacts what's going on at your knee. So if you come to PT, we'll have you do a lot of things with your shoes off so that we can kind of see where your weaknesses and limitations are, whether it's in your foot or your hip. Those are kind of common places where people are generally weak or don't have enough mobility. So it's typically a little bit more difficult to do them with the shoes off, but it also strengthens your feet at the same time. So for the squats and the single leg exercises, if you can do them barefoot, great. For plyometrics, I would recommend shoes just because it decreases that impact. And we don't want to have too much impact on the knees, especially if you're, doing these to get ready for a sport or in some sort of warm up.
And our last question of the day, really great question. Should you do the strength exercises more towards the beginning of a recovery and the plyometric ones more towards the end?
So this is actually a really good question. Typically, if once you get a good warm up in, so again, the warm up could be some of those exercises we went over in the beginning, that FIFA 11 warm up. So they involve a little bit of strength, but you want to do plyometric exercises early on in your routine because they're difficult. And if you do plyometrics when you're too fatigued, it's more likely maybe you could cause injury, and you won't get the most bang for your buck in terms of how high and how far you can jump. So there's things to be said for both sides. I think for injury prevention, sometimes people, like especially us as therapists, will put them towards the end of the workout to make sure that you can do these plyometric movements when you're fatigued. But generally, if you're trying to kind of gain agility and get better at your sport and get better at the plyometric movements, you want to do them after a good warm-up before heavy strength exercises.
Thank you everybody for your questions. We hope today's talk was valuable and that you learned a few ways to prevent and perhaps manage some of the symptoms you may have been experiencing in your knees. If we didn't get to your question, we will do our best to reach out to you directly afterwards. We'll also be sending out the handout of the exercises for you to have as a reference, because I know we went through a lot of them. As a reminder, your presenter for today was Sarah Lloyd, a PT from our 44th Street location. Feel free to jot down her contact info so you can reach out to her directly with any questions or schedule an appointment with her. Our Q&A moderator is George Stamboulis, who is also at our 44th Street office. And I am Ashley Rosick, and I'm from our 57th Street location. Feel free to reach out to any of us, as well as any questions you might have, and we could also help you get set up with an appointment with one of our many great therapists. As an orthopedic outpatient physical therapy practice, we treat an array of conditions from head to toe. And we're open for in-person visits as well as telehealth sessions should you feel that you could benefit from some individualized care and guidance. Please don't hesitate to reach out to any of us individually, and we will personally coordinate helping you get set up with an appointment. Lastly, at Spear, we will be hosting a webinar like this every Thursday evening at 5 p.m. for the rest of the year, covering a variety of topics. So be there, and we look forward to seeing you. Thank you all very much for spending the time with us today. We hope you enjoyed the webinar. Be well.